Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. Tonight, the topic that we are going to be focusing on, a very important topic, the importance of hearing in children. And our guest in studio is Sister Sumaya Soni. Before I actually introduce and welcome Sister Sumaya Soni, we will begin with the tarbiyah. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Prophet sallallahu alaihi wasallam said, the mercy of Prophet sallallahu alaihi wasallam, peace be upon him, said a strong believer was better than a weak believer. He was talking in terms of faith and character, but also indicating that physical strength, that is optimum health and fitness, were desirable, providing Allah gave us the ways and means of attaining such strength. Islam's holistic approach to life and thus health offers us the ability to remain strong and healthy. If Allah decrees that illness or injury are to be part of our lives, then Islam provides us with the ways and means of accepting and even being grateful for the tests and trials that envelop us. Believers in Islam must take care of their spiritual, emotional, and physical health. Our bodies, the most complex of machines, are given to us by Allah as a trust and amanat. They should not be abused or neglected, but maintained in good order. As discussed, diet and nutrition plays a big part in maintaining the best possible health. So does a lifestyle incorporating exercise. Islam lays emphasis on a simple diet combined with physical exercises. Prophet Muhammad, peace be upon him, advised his followers to work, to be energetic, and to start their day early, all of which are conditions for a healthy body. He said, quote, "O Allah, make the early mornings hours blessed for my nation," close quote. Obesity or an inadequate diet, laziness and weakness are all afflictions for which we will be called to account. Even though preventing illness or injury is often out of our control, there are many conditions brought on or made worse by our own lack of attention to diet and fitness. Prophet Muhammad sallallahu alaihi wasallam said, any action without the remembrance of Allah is either a diversion or heedlessness, excepting 4 acts: walking from target to target, training a horse, playing with one's family, and learning to swim. Exercise increases muscle tone, improves flexibility, enhances endurance, strengthens the heart, and fights depression. Exercise also helps achieve significant weight loss. All in all, it improves overall mental health. Islam encourages anything that promotes refreshing the mind or revitalizing the body, provided it does not lead to or involve sin, cause harm, or hamper or delay religious obligations. A true believer recognizes the wonder of the human body and is grateful to the Creator. Islam's holistic approach to health covers all aspects of the mind, body, and soul. A truly health-conscious person blends diet, nutrition, and exercise with the remembrance of Allah and an intention to fulfill all their religious obligations. Sadaqallahul Azim. We will now continue with our guest in studio, Sister Sumaya Soni, who is actually an audiologist and a speech language therapist. She's also a graduate of the University of Wits and comes with an honors degree in audiology and speech and hearing therapy. She also has an honours degree in English, and her specialist areas lie in speech and hearing and audiology. She works with both adults and children. She's been in the field for the past 10 years and however is now in private practice for the past 4 years. So Sister Sumaya actually comes in with a wealth of experience, skill and knowledge. Welcome, Sister Sumaya. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam. Jazakallah so much, Dr. Umar, for having me on the show. I really appreciate it. I agree with you that hearing is, and all the senses are such a vital part of our system, and we tend to take it for granted, and yet we should be grateful for the sense of hearing and all our senses that we were blessed with, and we should cherish and we should protect and look after them. Especially the sense of hearing, because hearing is important not just for listening and for hearing skills, it's also important for processing information, for the development of speech, language, communication skills, and learning skills as well. And without the sense of hearing and without our skill to be able to hear, we actually struggle and we lose out on language development, on communication, on so many aspects of our life suffer. And that's why my whole emphasis is on early intervention and to actually assess children early, and if there is a problem, there is something that we can do about it, because like the Quran says, there's a cure for everything. So it's the same with hearing, there is treatment for it. So it's better to do something about it sooner rather than later.
So Sister Sumaya is highlighting the importance of hearing in children, something which is not always tangible, not always visible and noticeable, especially in our very little children. So we're talking from babies, toddlers and older children. So Sister Sumaya, if you can tell us, at what age would you consider it important for a child to be tested for their hearing ability?
Definitely, children should be tested at birth. Within the first 24 to 48 hours, it's recommended at least within the first 6 months, because research has actually shown that if children are actually screened and assessed, and if there's hearing loss found within the first 6 months, and if it's treated early, the child will actually develop speech and language in the same way that their peers are developing, and on the same age, the same level, so they won't lose out. And after the age of 6 months, it's more difficult to now close that gap. You can close it, and it's still better to do something about it, but the first 6 months are crucial for hearing.
Okay, so it's critical, but what you are also instilling is that there is a positive message that if it is picked up early, if it's identified early, that mechanisms and interventions could be put into place to ensure that the child's milestones continue to develop like that of a hearing or child with an ability for hearing.
Yes, definitely.
So what are the different types of hearing losses that are faced by children?
So this brings me on to how the ear works. If you had to look at the ear, we have the outer ear and the middle ear and the inner ear. And depending on where which part of the ear is affected, that's the type of hearing loss you have. So if it affects the middle part of the ear, you have a conductive hearing loss, which generally would be an ear infection, which if you seek treatment is a temporary hearing loss. But if you don't seek treatment for the ear infection, it can actually affect the inner ear and become a permanent hearing loss. And then if the hearing was to affect the inner part of the ear, this is called sensory neural hearing loss, and that is permanent. That actually causes permanent damage. So it's very important that if you've got an ear infection, if it's a conductive hearing loss, to do something about it so it doesn't become a permanent sensory neural hearing loss. And if it's a permanent sensory neural hearing loss, then we've also got management for that as well.
So Sister Sumaya, you are absolutely a specialist in this field, but for us lay people on the ground, if you could unpack that and just spell it out a little bit more directly, the two different kinds of hearing loss that you've described to us?
So the inner ear is where we would find it almost looks like a seashell, and we call it the cochlea. And there's a nerve that actually connects from the cochlea to the brain. So a lot of it, we actually hear with our brain, not really with our ear. It's
interesting. That's fascinating. So are you saying that those signals or those messages are not relayed to the brain?
Yes, it's not relayed to the brain. So there's some hair cells that are damaged, and they're not in the inner ear, in the cochlea. So it doesn't pick up the sound, and it doesn't relay to the brains, which is why they'd be missing out on some information. And later on, I'll talk about how, you have different degrees of hearing loss as well.
And so, what happens if, say, the newborn, as I see, and I've seen babies, of course, babies born in our own family, or my grandchildren, where within the first few days they are screened, where they undergo the hearing tests. So what happens if they fail those screening tests? What does that mean? What does that translate into in terms of the prognosis of hearing for their child?
So if you fail the hearing screening, it doesn't necessarily mean that the child has a hearing loss. A lot of the time, there's two methods for testing hearing in newborns. There's the OAE, the autoacoustic emission, and the other method is the ABR, the automated brain response. Generally, the more commonly used is the OAE. And it's just a little probe that you put inside the ear, and it automatically, in a short period of time, does the test, and it can tell you if there's cochlear damage or if there isn't. But because it passes through the middle part of the ear, if there's fluid in the ear, so there's an ear infection, it will pick that up as a hearing loss. So it might not actually mean that the child is deaf. It's just showing up as a hearing loss because they have fluid in the ear. So like fluid in the ear can also cause temporary hearing loss. So once that's cleared and the ear infection's treated, and if you tested the child again, they might actually have normal hearing because the inner ear is not damaged. But if there is no ear infection and you did do the screening and it showed up as a fail, then we would actually retest in a few weeks.
So you would not accept that as a final diagnosis. You would do a follow-up in a few weeks to ascertain if there was this was as a result of fluid buildup, or is there some other underlying cause that has presented with this kind of symptom?
Yes, and also the reason as well is because the way we test hearing, there's a whole test battery approach. You have to put together a few tests to make sure that, because they all serve a different purpose. So once you've done the OAE a second time, then you do a full diagnostic assessment. Yes.
So thank you for that. I think that's fascinating and interesting. And on that note, we'll take an ad break and continue with the importance of hearing in children. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. For the viewers that have just tuned in, our guest in studio tonight is Sumaya Soni. Sister Sumaya is an audiologist and speech and hearing therapist, and the focus of her topic tonight is on the importance of hearing in children. I think I just want to alert the viewers to the fact that we will be taking questions from the third segment, so feel free to call in after this segment with questions and comments. Sister Sumaya, we ended on the diagnosis and the battery of tests that you run, but we need to also look at the fact, so what actually happens? Say that a baby is born and they get screened for hearing deficits and they get a clean bill of health regarding that at the time of birth or after the birth. Does that mean it ends there, or is there any other follow-ups, any further checkups that parents need to be aware of and alerted to?
Definitely. It's actually recommended that all children under 6 years of age should have their hearing tested at least once a year. And if they have hearing-related problems, they should come more often, at least every 6 months. And in fact, even if they are fitted with hearing aids, if they're actually under 3 years of age, especially they would need to come every 4 to 6 months. So the younger children, especially because they're more prone to ear infections.
Okay, so I like what you're saying, that even after that screening, after birth, that there are risk factors that could contribute to hearing deficits in children, where one would not be able to pick up, as I mentioned earlier on, that it's not something that's visible or easily detected by a significant other or by a primary caregiver. So it is critical that the child actually goes for regular testing, and this needs to be consistent. And you have highlighted already one of the risk factors, where children are prone to ear infections. That is something that one would definitely need to follow up on.
Definitely. I mean, you can even have progressive hearing loss. It's not always that, if you pass the hearing screening, that you might not develop a hearing loss at a later stage. So it's always important to check hearing, especially in children.
So we spoke about one of the risk factors, but there are obviously many other risk factors, and perhaps you can elaborate on some of the risk factors that contribute to hearing deficits and hearing losses in children.
Definitely. So we have hereditary and non-hereditary factors. Hereditary would be family history of hearing loss. Family history is always one of the main factors. It's actually 50% is a contributor towards hearing loss. And then genetic syndromes, so like Down syndrome and Turner syndrome, Waardenburg syndrome, that's another factor. And then non-hereditary factors would be prenatal infections. So, for example, if the mum had measles or herpes, or illnesses like if the mum had maternal diabetes, toxins consumed by the mum during pregnancy, so drugs or smoking.
So the substance abuse. So you're talking about alcohol and Schedule 6 drugs, and of course the toxic substances that you make reference to could all impact on the child's hearing as well.
Yes. As well, other conditions occurring at the time of birth or shortly after, so like a prolonged or difficult labor, and maybe there was a lack of oxygen for the child. So those are all factors that can, contribute to the fact that a child might be born with a hearing loss.
So, Sister Sumaya, I just want to check with you. I mean, we often see there are exceptional cases where, say, both parents have hearing deficits or are hearing impaired, and yet they would have children where maybe two of the children are hearing, are challenged as far as their hearing abilities are concerned, and then having another two children where they actually are able to hear. And how does one explain that?
It's to do with genetics.
Okay.
There's a recessive gene, and you might have a dominant gene, and it just depends which gene you inherit. And that there's actually the 50% chance that you could get the hearing loss.
So it's possible that when these tests are done, it may not be picked up immediately, but later on one could actually identify that. And something that I've also seen is that, the first generation, the second generation, it might skip that generation, and then it affects the third generation.
Yes.
And is that also attributed to the configuration of the genes?
Yes, definitely. So I think in that case, there'd probably be a 25% risk factor, and it just so happened that in the second generation, one of the children inherited that small risk factor for it, and that's the reason why it developed the hearing loss.
But you would caution parents always to be on the lookout and follow up on regular testing, regardless of whether there's a gene contribution factor or not.
Yes, definitely. All children should be, because in some cases it's idiopathic. You might, the doctors actually don't know why a child might just be born with a hearing loss. There might actually be no reason or no underlying cause. So it's always good, especially in children, as I mentioned, because they are more prone to ear infections, and that's a big risk factor.
And then I think something that one needs to consider, and I mean, just from the kind of work I do, that trauma, trauma-inflicted injury that could also contribute to hearing deficits, and I think you will be speaking more to that. We will continue with that. We're going to take an ad break, and we will speak more to other risk factors that contribute to the hearing deficits in children. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters, and the focus is on the importance of hearing in children. Sister Sumaya Soni, who is our audiologist and speech and hearing therapist, is talking about that. And before the ad break, she spoke about trauma-inflicted injuries contributing to hearing loss. So we'll pick up on that, but I also want to remind the viewers, please feel free to phone in with your questions and comments. Sister Sumaya will be willing to answer and engage with you. Shukran. Sister Sumaya, we had some interesting discussions during the ad break. Perhaps you can pick up on that, please.
Yes, definitely. So we were talking about acquired hearing loss, and one of the factors was head injury. And head injury can be, which is actually causes then hearing loss. And for example, if a child was involved in a car accident, or they had an accident at school where maybe another child's accidentally hit them, or they fell off a swing, or maybe even they suffer from epilepsy and they fell and they hit their head. A lot of the times that can actually result in a hearing loss.
Okay, so even if a child experienced somebody slapping them across the face, whether it's an educator, another person, another child, and falling down, which is such a common occurrence, and one often takes that for granted. So this is something that one needs to be more vigilant about and exercise more caution by following up. So what would be the immediate step that you would expect a parent to follow through on?
Definitely they should bring the child in for a hearing assessment, because a lot of the time they actually do present with hearing loss. And in some cases as well, they'll also complain of ringing in the ears, which is also known as tinnitus, which is another symptom of, a head injury related hearing loss.
Okay, and also if I could just also mention even shaking babies profusely, the typical shaken baby syndrome, which could result in acute head injury.
Yes.
And that could affect the hearing as well.
Definitely.
So thank you for that. I think that's quite informative. But just to allay fears and anxieties of primary caregivers and parents regarding the actual testing process, how painful is it? Does it affect the toddler, the child? And then what impact does it leave on the child?
So the actual test that we use is a automated test. It's spontaneous. It doesn't take very long. It takes less than 5 minutes. It's not painful at all. We can even test the infant when they're sleeping. And this test is actually called an otoacoustic emission, an OAE, and it's just a little probe that's inserted into the ear. And from there, it gives us a signal directly from the cochlea to see if the hair cells of the cochlea in the inner ear are functioning well. And from that, we can determine if the child has a hearing loss or not, or if they need to be followed up for further testing. And it's not painful at all, and it's nothing to worry about.
So it's quite reassuring to know that a child will not experience any pain. You said that if a child is sleeping, the child would continue sleeping without feeling at dis-ease in any form or shape. So, it is something that parents should not worry about or be anxious that their child is going to be hurt or that it's quite an intrusive or invasive procedure.
Yes, definitely. It doesn't take long at all. It's not painful, and it can be used in infants, in adults, in any client population. So it's actually a very useful test, and it's
okay. So you've mentioned this test. You've mentioned other tests, but if you can speak more to the different kinds of tests that you apply to ascertain the hearing abilities of a child.
Definitely. So, especially when we're doing diagnostic testing, we have a certain tests for certain age groups. So the behavioral observation audiometry is for children 0 to 5 months, and that's just observing their general responses, if their eyes widen, if they startle, because that gives you some indication if they're hearing the sounds presented. And then we get VRA, which is visual reinforcement audiometry, where that's from 6 months to 2 years of age. And in that case, children obviously at that age can't respond to tell you if they're hearing or not. So when the sound is presented in the audiology booth through the speakers, when the child looks that way, we reinforce the behavior with something that will encourage them to want to listen for the sound. So it's a bright toy, or it's nowadays we actually have videos that you can put up.
So you have visual cues that will capture their attention.
Yes.
And then elicit responses from the child.
And that way they get conditioned. It's behavioral psychology.
Okay, so okay.
So they get conditioned to want to listen for the sound, and in that way we can actually assess if they can hear it and at which thresholds and what levels they're able to hear it at, the sounds at. Yes, and then we also have condition play audiometry, which is for children from 2 to 3 years, where obviously it's a normal hearing test in an audiology booth. But the only thing is we have to make it engaging and fun for children because they get bored quite easily.
But now you're talking, these are children or beyond the 1,000 days. These are older children that we're talking about, because if you're putting them in an audiology booth, already you're saying that you're separating them from the parent. Am I correct?
Yes.
Okay.
But often the parent can sit in with the child and assist the child with these tests.
Okay.
Like even the play audiometry.
Nice.
They actually sit in the audiology booth, and
so there's no separation anxiety.
No.
Okay.
Even with the VRA, they usually sit and they'll hold them on their lap, and I'll actually be sitting there and distracting the child to keep them focused on the midline so that they're not looking sideways. So when the sound's presented, we know that they look that way, not because they were being distracted, but the sound was presented that side.
Sumaya, I'm going to interrupt you. We've got a caller on the line. Assalamu alaikum wa rahmatullahi wa barakatuh. Hello? Hello? It seems like we've lost the caller. Sorry about that. We'll continue.
That's okay.
But you said something important, and for me that would be one of the indicators, I think, to identify, and I like what you said, that at different stages or phases of development we would expect certain responses from a child. So when would you look out for startled responses, where the child, shows at the sounds that he or she is exposed to, and of course the extent or severity of the noise? When would you expect a child to respond to those kind of sensory inputs?
It would be between 0 to 5 months of age.
So even at 0 months, are you saying when they're just born, they are able to respond to noise, to the noise factor?
Yes, they should be able to.
So if there's a bang or an object drops on the floor, one would expect them to respond. And in a newborn, what kind of reflex are you expected to look out for?
So you'd see them startling or almost like jumping or getting a fright, just and if you don't see that, you'd
body movement, eyes.
Yes, body movement, eyes. They almost look like they shake.
Okay, so we've got another caller. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu.
Wa alaikum salam. Please go ahead and ask your question to Sister Sumaya.
Jazakallah to Sister Sumaya for a very informative and well-presented talk. I'd like to ask Sister Sumaya just two questions.
Okay, but I think, have you got your television on? Please switch it off and go ahead.
Okay, can you hear me now?
Yes, please go ahead.
Okay, question number one. I'd like to know what age can you use hearing aid? And children, how can you cure the aid without the child ripping it off? And that question number two is how often patients come for follow-up with after hearing aid has been fitted to them. Now I know she mentioned that, but just have a, it would help maybe for some other little.
Did you get that question, Sister Sumaya?
I think I did understand. I think it was related to, like, if a child has hearing aids on, and how do we make sure that they won't fall off? That was the one question. So we actually have retainers that, you know, children can, with the accessories for hearing aids, which children can wear, and it actually clips to their clothes. So in the event that it does fall off, it doesn't get lost. And also with younger children, they have battery tampered doors, so they can't open the battery door and they won't be able to have, you know, mistakenly swallow the battery, or there are precautions in place for children who have hearing loss. And the second question was, how often do children who have hearing loss need to come through for, I think, follow-ups. So if a child has...
If they're wearing a hearing aid,
yeah.
The follow-up, if I understood that question correctly, yes.
Yes, I think, so that would be, if you've been fitted with a hearing aid in your child, so within the first 2 years, it's important to come every 3 months for follow-up. And after that period of 2 years, then you can come every 4 to 6 months. So that would be, it's important if you have hearing loss in children. The other reason as well is children, because their ears are developing, they outgrow the ear molds that we have to make for them for the hearing aid. So every month or so, you actually have to remake a new ear mold.
Interesting. So one
Yes.
actually needs to measure their ears as they grow as well.
Yes.
Shukran, that's fascinating. We'll take an ad break and continue with the importance of hearing after the ad break. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. And our guest, Sister Sumaya Soni, who's an audiologist and speech hearing therapist, who has been explaining the importance of hearing in children and has been recommending that there needs to be early screening, consistent and regular follow-ups, even after the initial screening that takes place when the baby is born. But Sister Sumaya spoke about hearing aids, and I think we had a caller who actually raised some pertinent questions, which was answered by Sister Sumaya. And picking up on those hearing aids, now you did say that in order to prevent the loss or prevent any kind of shame, that it was actually the aesthetically pleasing. But perhaps you can speak more to that, explaining the availability of the different kinds of hearing aids and at what ages does what become available.
Yes, no, definitely. So a lot of people associate a hearing aid with a big, like noisy device, and the technology has improved so much. In fact, if I was to show you, this is what invisible hearing aid. It's as small as that, and that actually fits right inside your ear.
Okay, so this is like a perspex thing that goes right inside, so it's actually not visible to the naked eye unless you come close up. Okay.
Yes, even if you came close with that, the custom instruments, which are slightly bigger, you'd see, but that actually goes right inside the ear canal.
Okay.
It's actually invisible hearing aid, so you won't see it at all. So the technology has improved so much.
So there's no embarrassment or shame in wearing something like this because it's not visible to the naked eye.
Yes.
Unless, of course, an audiologist like yourself inspects it or looks for that.
Definitely, and even the hearing aids have become a lot smaller if you had to look at these hearing aids.
Okay, and this is for a child?
Yes, it actually, from the age of 7 and under 7, we usually have a slightly bigger hearing aids because children under 7 are still developing and they need an ear mold and they need a more powerful hearing aid.
So they have, if I can recall, it's something that they wear behind the lobe of the ear.
Yes.
It surrounds the entire lobe of the ear, and you say they continue wearing that kind of instrument or device until the age of 7, and thereafter, of course, they have a wider range or variety of hearing devices.
Definitely. After the age of 7 or 8, they have a variety of hearing instruments to choose from. But it's important that parents actually get the children's hearing tested and fitted early, because the first 6 years of child's life is crucial for language development.
And long-term development, absolutely. But something that you spoke to earlier, which I think is so important, where you said that it is imperative that there's initial screening and testing and follow-up testing. So you also alluded to some of the denials or parents not accepting that their child is experiencing hearing loss, and of course seeking second opinions. And maybe you can share some of those kind of experiences with us to make the viewers aware of these challenges.
Yes, it is. I suppose there's always, whenever someone's faced with a challenge or a difficulty, we all go through a grieving process, and it's this whole 7-cycle stage of grief. So a lot of the time parents will be in denial, or they'll be angry, or they'll be upset, or rarely you'll find parents who are accepting that their child has a problem. And it does take time for them to finally accept and come to terms with, oh no, my child actually has a hearing loss, I need to do something about it, I need to help them. Often it takes about a year for them to actually come back and say, okay, no, we need to do something about it. You do get some parents who are more accepting, and they more, realize that, if they do something about it sooner, then, that will help their child. And a lot of the time it's the children who are actually motivating the parents that they want a hearing device, because they're struggling to hear, and they're struggling at school, and they're struggling in the environment, and they actually they're actually happy when you put the hearing aid on for them and they can suddenly hear. They're so excited, and I think that actually motivates parents to realize, oh wow, it's actually making a difference in my child's life.
Sister Svea, what you are speaking about is so important. If we look at some of the children at ECD level, and how often they go misdiagnosed, where sometimes a child is diagnosed with the autistic spectrum, or the child is diagnosed with oppositional defiant behavior. In actual fact, because of the lack of screening or follow-up, the child is not able to hear, and the child is trying to get some kind of attention because the child is probably just looking and trying to read the lips and cannot hear, and those are the challenges and some of the symptomatic reactions that we see, our children acting out.
Yes, definitely. A lot of the time, you might not realize it's actually that a child has a hearing loss, and I've even seen cases where a hearing loss was diagnosed only because the child was supposed to be sent to a special school, which could have been prevented if they had detected the hearing loss sooner. because, you know, they have this huge gap, and now it's a bit, you know, it's going to take a lot to close that gap. And if it had been detected sooner, they wouldn't have had that gap in their learning. And there's a lot of signs that, you know, parents should be aware of. For example, if a teacher is concerned, you know, there's something that, you know, that the family should be aware of, maybe that the child has a hearing problem, they should take that seriously. Or if another family member is concerned, or if they feel that, you know, the child is delayed in terms of their speech and language development compared to their same age peers, or if the child, like you said, is having difficulty with behavior and attention and academic performance, that could also be as a result of a hearing loss. And as I was saying, it's not always a permanent like hearing loss that's an inner ear cochlear damage. Sometimes it's because of recurrent ear infections. And if recurrent ear infections or like persistent fluid in the ear is there for 6 weeks or so, the child actually has a temporary hearing loss, which means that they're not hearing very well in that period. And so that's why they're not doing very well at school, because they're not hearing well and their speech and language is suffering. So it's not always permanent. Sometimes it's temporary, and if you come for a hearing assessment and we actually pick it up, you can do something about it. Like you can go and see a doctor, and they can actually give you treatment for it, and it will clear up the ear infection, and the child should be okay. But it's only when, you know, you don't have treatment, and then the ear infection or the middle ear pathology then turns into a permanent hearing loss because it's affecting the inner ear. That's when it can become more of a problem than it should be.
So, Sumaya, we're coming to the end of our program. We've got 3-4 minutes left. I want you to just perhaps give some take-home messages to parents, to would-be parents, and of course to grandparents as well, as to what they need to look out for in their children, grandchildren, little children in their families that they see on a daily basis. What is it that, and how can they prevent it? I think firstly to identify that, and what steps to follow through. Just a quick summary.
So they should watch to see if their child is pulling or tugging at the ears, if it's especially if it's a younger child. So that could be a sign of an ear infection. If there's fluid or pus coming out of the ear, that's also signs of ear infection. If they're putting the audio electronic devices too loud, or sitting too close to the TV, or frequently asking for repetition, or asking...
Also say like that, huh?
Yes.
Huh? That kind of, question, yeah.
Yes, questioning.
Or what?
Yes, if they're irritable, they're not understanding, they're slow to respond to voices or other sounds. And then also in like older children as well, if even signs like nausea or vomiting or dizziness or pressure in the ears or constant earache, those are also signs that could be an ear infection, which also results in a temporary hearing loss.
So is it just earache, or would we also have referred pain elsewhere?
What do you mean by
referred pain? Maybe to the head, of the child says I'm getting a headache, or it's sore maybe on the jaw. Is the pain localized? That's what I want to ask you. In
Generally,
most cases,
it's mostly it's mostly ear pain.
Okay.
But
and that's what parents need to look out for.
Yes,
hey?
generally, yes.
Okay. So words of advice to parents. The treatment, what do they need to do?
So in terms of treatment, you would have to seek out your family physician or your pediatrician, and they can generally provide treatment for ear infections. But if it becomes recurrent or it's quite severe, they would refer to an ENT, who's a specialist in treating ear, nose, and throat conditions. And if it's related to audiology, which is anything to do with hearing, then you'd refer to the audiologist, and the speech therapist if it's related to language or speech development.
Okay, so sometimes it could be related to the hearing loss, and therefore that affects the speech, delayed speech development.
Yes.
But there might be other underlying reasons that the child may not be able, the speech delays that they manifest with. Any other things that you would like to share? Also,
like speech and audiology and speech are so interrelated. So even if you looked at the developmental milestones, the speech and language developmental milestones, you'll see that there's certain milestones or that children should have reached by a certain age, and if they haven't reached those milestones by a certain age, you would know that there must be something that's, it's either a speech-related condition or it's a hearing-related condition. And often, because if it's a hearing-related condition, it's going to affect your speech and language development. So it's always important to look out, especially for their speech and language development.
Okay. And in certain cases where there are real huge challenges, where the long-term prognosis requires surgical procedures?
Yes, in those cases where it's permanent sensory neural damage, which is damage to the inner part of the ear, then the child would require hearing aids. And hearing aids can actually fit like different degrees of hearing loss. So just because you have a hearing loss doesn't mean you're completely deaf. You might have a mild hearing loss, a moderate hearing loss, a severe hearing loss, and then you get profound. And only if you have a profound hearing loss would you then consider a cochlear implant.
Okay,
yes.
So only in those cases, and of course that would be at the recommendation and advice of an ENT surgeon.
Yes, definitely. And you would have to have tried hearing aids first, and only if they weren't providing benefit, then you would consider cochlear implants.
Any other words of advice or caution to the viewers out there before we end?
I would just like to say that it's important, as we mentioned and we were discussing from the beginning, for parents and to encourage children to protect their hearing and to educate them on hearing loss, and especially noise, because noise is the biggest factor that causes hearing loss. And to monitor, especially these MP3 players and all these audio electronic devices, you can adjust the levels to make sure it's not going above 85 decibels, which is when it starts becoming harmful. And a lot of those audio electronic devices can go up to 110 decibels in some cases.
So that's important to monitor the sound factor, the noise factor.
Yes.
You're saying to go beyond 85 decibels. That's something certainly new, and I think it's something that we need to be aware of. But I think I just want to take the viewers to just imagine a world without sound, waking up one day and you cannot hear. There's lots of a hive of activity and you cannot hear. I mean, that would be a real tragedy. And as you have so beautifully highlighted in the beginning of the interview, that hearing is a gift from Allah, and it is part of our body. It's an amanat that we need to nurture, appreciate, and look after. Shukran dalilan for this most informative, enlightening, and I think awareness-raising information that you have given on the importance of hearing and what one needs to look out for and how to follow up consistently, looking at the well-being of children and looking at their trajectory and development. So Sister Sumaya, I think the viewers would certainly agree with the information that you have shared. It has certainly made a huge impact on our knowledge levels, and of course looking at well-being of children in general. And on that note, we will end with a tarbiyah. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Wal asri innal insana lafi khus illa alladhina amanu wa amilu salihati wa tawasaw bil haqq wa tawasaw bis sabr. Sadaqallahu al-azim. Until health matters next time. Sadaqallahu al-azim. Assalamu alaikum wa rahmatullahi wa barakatuh.